Yes, and I know you, as I said earlier, you've had extensive experience at the state level, but with respect to Medicaid, let's take our state, and we're pretty representative, I think, of all 50 states. We have a Medicaid program now that provides for coverage or eligibility at 100% of the poverty level. This bill takes that to 133% of the poverty level. Talk for a minute about the impact of going from 100 to 133% to cover some of those uninsured that I referred to earlier. What's the impact on our state?
Well, right now in the state of Georgia's current year budget, the cost of Medicaid is $2,150 million, about 12% of state appropriations. This bill, as it's currently configured, raises eligibility by 33%, but the feds hold harmless the states for the first 3 years of that increase, and then it's a 90-10 split for the next 3 years, and then it's silent. So let's give everybody the benefit of the doubt and say the states only have to pay 10% more. That's $250 million more in Georgia. You go from $2.15 billion to $2.4 billion in a state budget that's compressed. And then, quite frankly, we all know what ultimately is going to happen is what happened with the first Medicaid. And that is the state's going to have to pay the full 35%, which would mean over time, at the end of that 10 years, using today's numbers without inflation, Medicaid cost in Georgia for about 12% of the population would go from $2.15 billion to $3.4 billion a year for Medicaid.
Whether it's paid by the federal government after that 3 years or whether it's paid by the state of Georgia, whose pockets are going to come out?
It's coming out of the taxpayer's pocket of the United States of America.
Yeah.
Or as we